Good afternoon, Sarah. Today we're discussing a common issue that affects many people's health, particularly regarding how they take their vitamins. Specifically, we're focusing on vitamin B12 and a mistake that 95% of people make: incorrect dosage.
Hi, Dr. Mike. That sounds interesting. So, what's the problem with how most people take vitamin B12?
Well, Sarah, the issue lies in not taking the right amount. Vitamin B12 is crucial for nerve function, red blood cell production, and DNA synthesis. However, many either take too much or too little. An incorrect dose can make the vitamin less effective and, in some cases, even pose health risks.
What happens if someone takes too much? I always thought more vitamins meant better health.
That's a common misconception. While it's rare to have toxic levels of vitamin B12 because it's water-soluble and excess usually gets flushed out, taking an unnecessarily high dose can lead to side effects. Some people might experience headaches, dizziness, or anxiety. More importantly, it can mask symptoms of certain medical conditions, delaying diagnosis and proper treatment.
And what about taking too little? How does that affect our health?
Taking too little vitamin B12 can lead to deficiency, which is particularly concerning. Symptoms of deficiency include fatigue, memory issues, and even neurological changes. For example, a friend of mine, Clara, ignored her mild symptoms, thinking they were just stress-related. Turns out she had a significant B12 deficiency that was affecting her nerve function.
That's quite concerning. How does one know the right amount to take then?
Great question, Sarah. The recommended daily amount varies by age, dietary habits, and health conditions. Generally, adults should aim for about 2.4 micrograms per day. But it's always best to consult with a healthcare provider who can recommend a dose based on individual health needs.
It seems like it's not just a matter of popping a pill and hoping for the best. There's a lot to consider to get it right.
Exactly, Sarah. It's all about balance and ensuring you're listening to your body and consulting with professionals. Tailoring your intake to your specific needs is key to making the most of vitamin B12's benefits. Now let's move on to the second common mistake people make with vitamin B12: taking the wrong form of it. There are several chemical forms of vitamin B12, and each one can have different effects on your body.
Different forms? I didn't realize that was a thing. What are the main forms?
Yes, it's quite a nuanced topic. The two most common forms you'll find in supplements are cyanocobalamin and methylcobalamin. Cyanocobalamin is a synthetic form that the body needs to convert into methylcobalamin or adenosylcobalamin before it can be utilized. Methylcobalamin, on the other hand, is a natural form that's ready for the body to use immediately.
So, is one better than the other?
It depends on the individual. Methylcobalamin is generally considered more bioavailable, which means the body can use it more easily. It's especially beneficial for people with certain genetic mutations that affect how their bodies process vitamin B12. However, cyanocobalamin is more stable and has a longer shelf life, making it a common and cost-effective choice in many supplements.
How does one decide which to take?
Typically, a healthcare provider would recommend a form based on a person's overall health, genetic factors, and lifestyle. For instance, if someone is a strict vegetarian or vegan, I might recommend methylcobalamin because it's better absorbed and utilized, especially if their diet lacks adequate B12.
That makes sense. Could choosing the wrong form affect one's health?
Absolutely. For example, if someone with poor absorption takes cyanocobalamin, they might not convert enough of it into the active forms their body needs, leading to a functional deficiency despite taking supplements. This could manifest as fatigue or neurological symptoms, similar to a straightforward B12 deficiency.
It sounds critical to get this right, especially with such important roles vitamin B12 plays in the body.
Indeed it is, Sarah. Ensuring you're taking the right form of vitamin B12 can significantly impact your energy levels, brain function, and overall well-being. It's a perfect example of why personalized nutrition is so vital. Moving on to our third point, another mistake people often make with vitamin B12 supplementation is inconsistent timing. Maintaining a consistent schedule when taking B12 is crucial for optimal health benefits.
Inconsistent timing? How does that make a difference?
Consistency is key with many nutrients, including vitamin B12. When you take it sporadically, the levels in your body fluctuate, which can reduce its overall effectiveness. For B12, stable levels help maintain energy, cognitive function, and metabolic balance.
So, what's the best way to take it to ensure these levels stay stable?
It's generally recommended to take B12 at the same time each day. If you're using a daily supplement, try to take it with breakfast or another consistent mealtime. This not only helps with absorption when taken with food, but also makes it easier to remember your supplement each day.
What happens if someone forgets a dose? Is it better to double up the next day?
Good question, Sarah. It's better to just continue with your normal dose the next day. Doubling up isn't necessary with B12 due to its water solubility. Your body will excrete any excess. However, making a habit of missing doses can lead to those fluctuations we talked about, which might diminish the benefits.
Can you give an example of how inconsistent intake might affect someone in real life?
Certainly. Let's say someone like John, an office worker, takes his B12 irregularly, mostly because his routine varies and he often forgets. He might start noticing that his energy levels are all over the place, feeling energetic some days and lethargic on others. Over time, this inconsistency could even impact his mental clarity and memory.
I see. So sticking to a schedule not only helps with physical health, but also with mental performance and overall well-being.
Exactly. Just like a medication, consistent use of supplements like vitamin B12 allows the body to maintain a level that supports optimal functioning. It's a simple step that can make a big difference in how effective your supplementation is. The fourth common mistake people make with vitamin B12 involves ignoring nutrient interactions. This is crucial because certain medications and other vitamins and minerals can interfere with how well your body absorbs vitamin B12.
Nutrient interactions? Could you explain that a bit more?
Certainly. Let's start with how some medications can affect B12 absorption. For example, long-term use of proton pump inhibitors, commonly used for acid reflux, can decrease stomach acid production. Since stomach acid helps release B12 from food, reducing acid levels can lead to poor B12 absorption from dietary sources.
That sounds concerning. Are there other medications or nutrients that have similar effects?
Yes, another example is metformin, a medication used to treat type 2 diabetes. It's known to interfere with calcium metabolism, and calcium is necessary for the proper absorption of B12. So, people on metformin might need to monitor their B12 levels closely and possibly supplement accordingly.
What about interactions with other vitamins or minerals?
Great question. Vitamin B12. Absorption can also be affected by the presence of other nutrients. For instance, high doses of vitamin C can break down vitamin B12 in dietary supplements, which is why it's recommended to space out taking these vitamins rather than consuming them simultaneously.
It really seems like a balancing act. How can someone manage all these interactions to make sure they're getting enough B12?
It is indeed a balancing act, Sarah. The best approach is to have a thorough discussion with your healthcare provider about all the medications and supplements you're taking. They can help you plan out your supplement schedule and even recommend specific forms of B12 that might work best for you considering these interactions.
So, if I understand correctly, being aware of these interactions and managing them properly can really enhance the effectiveness of taking vitamin B12.
Precisely, Sarah. By being mindful of these interactions and adjusting your intake accordingly, you can maximize the benefits of vitamin B12, supporting your nervous system, energy levels, and overall health effectively. The final common mistake people make with vitamin B12 is not considering dietary sources and relying solely on supplements. It's essential to understand that while supplements are useful, especially for certain groups of people, dietary sources are also very important.
I've always wondered about that. Are supplements not enough?
Supplements can be a crucial part of maintaining adequate B12 levels, especially for those who have absorption issues or follow a diet that lacks B12, like vegans or vegetarians. However, B12 from natural food sources is more readily absorbed and utilized by the body.
What are some of the best dietary sources of B12?
Excellent sources of vitamin B12 include meat, fish, dairy products, and eggs. For example, beef liver and clams are packed with B12. For vegetarians, dairy products and eggs are viable options, and for vegans, fortified foods like some cereals, nutritional yeasts, or plant-based milks can be good sources.
So, could ignoring these dietary sources and relying only on supplements cause problems?
Yes, it could. For one, relying solely on supplements might lead to missing out on other nutrients that come from B12-rich foods, like protein, iron, and omega-3 fatty acids found in fish. Additionally, over-reliance on supplements without considering dietary intake might lead to unbalanced nutrition.
That makes sense. It seems better to try to get B12 from both food and supplements if needed.
Absolutely, Sarah. A balanced approach is always best. It ensures you're not only getting B12 but also a spectrum of other nutrients that support overall health. For instance, incorporating a variety of B12 sources can help maintain energy levels more naturally and support metabolic and neurological health.
It's clear now how a thoughtful approach to vitamin B12, considering both supplements and food, can make a significant difference in health outcomes.
Exactly. It's all about understanding your body's needs and how best to meet them through a combination of diet and supplementation. This holistic approach ensures you get the full benefits of vitamin B12 and supports a healthy, vibrant life.